Phillips County Health Systems understands that now more than ever it is important to pay attention to mental health, fostering hope and healing in their patients. Mental health care specialists find joy in their profession. Let's take a closer look at what some of these jobs involve. We'll start by introducing Carmel Engelke.
I'm Carmen Engelke. I'm an LS-CSW here. I got my education through Fort Hays State for my bachelor's, and then I got my master's through the KU Advanced Standing Program. I've worked here at Phillips County Medical Clinic for almost 6 years now. I work with children and adults ages 5 and up. I do play therapy, cognitive behavioral therapy, amongst other therapeutic modalities. So I come in the mornings, and that's kind of for an hour I get to just kind of start my day. Every social worker has to have their cup of coffee first thing in the morning, and then I get an hour just to do some documentation. And then I start seeing clients or patients at 9 a.m. and I see each client for roughly an hour. And then, so I see roughly 7 to 8 patients a day. And I get to spend an hour with them doing therapy, listening to kind of what's been going on in their lives, trying to figure out treatment plans or how I can best serve those clients, and help them through whatever challenges or difficulties they're going through. I also work very closely with the other providers here, so if there's a patient in to see one of the providers and they're struggling with something too, I can pop into the exam room and do what we call a brief intervention, offering them counseling or offering them some solutions to help solve whatever they're going through.
Another rewarding profession in mental health includes helping seniors navigate the difficulties that go with aging. Cassie Seaman, who is the program therapist of Senior Life Solutions, tells us more.
My name is Cassie Seaman, and I am the program therapist for Senior Life Solutions here at Phillips County Hospital. Senior Life Solutions is an intensive outpatient program where we are uniquely designed to meet the needs of seniors age 65 and older. We are able to provide group therapy here on site at the hospital. We're also able to provide individual therapy, and we are overseen by a psychiatrist who meets with our patients once monthly. Our group topics focus on a range of things, including takeaways, psychoeducational information, just helping give patients something that is tangible that they can take into their everyday life to help them promote and enhance their mental, emotional health, as well as their relationships both inside the group and outside of the group. We think what is unique about our program is we really take a multidisciplinary and collaborative approach, working with patients' physicians, their family. We also have RN that's on our staff, our program director, Ashley Delaney, as well as an office and patient coordinator, Claudette Graham, who helps assist the patients every day with setting up their transportation needs, overseeing any medication needs or changes. We take patient vital signs, blood pressures to help monitor and engage any changes that might be going on with them physically, so that we can help address and be proactive and working with their physician to manage those needs as well.
Sometimes healthcare professionals evolve into new opportunities and passions, which is the case with Robin Burwell, the psychiatric mental health nurse practitioner at PCHS.
I started as a nurse many years ago, and then desired something more, so went back and got my family nurse practitioner degree, and then 2-3 years ago went back and furthered my education and went into mental health and psychiatry. So, and I've always wanted to be a nurse. I'm not really sure what else I would have been. So usually it's trying to get like paperwork done that's left over from the day before, and then also just returning phone calls, answering questions for my nurse, and then we start in seeing patients. So, and then it's patients all morning until noon, and then you have a little bit of time for lunch, and back seeing patients at 1 o'clock in the afternoon until 5. And then you do whatever paperwork is left over then. So usually get home 5:30, 6 o'clock usually. My piece is more of medication management. So they come in and talk with me about what's been going on in their life, and we try to come up with like a diagnosis for what they're going through. And then we decide treatment plans together. So it's looking at, would maybe you benefit from more counseling versus actually medications. And so then we would refer on to Carmen, and then if we decide to do medications, then we have them come back and see me until we get them kind of evened out a little bit.
Overall, when working in the mental health field, you get to directly contribute to positive changes in people's lives. That satisfaction that comes from this type of career makes this more than just a job. It's fulfilling and impactful.